Hi, my name is Maureen Fish, and this is going to be my head-to-toe assessment. First, I'm going to show you my note card. That's the front, and this is the back. Okay, and then this is my environment, patient, okay. All right, so we will get started. So, hi, my name is Maureen Fish. I'll be your student nurse today. I'm going to close the curtain to provide privacy for us, and then I'm going to perform hand hygiene, and then I'm going to ask my patient for 2 identifiers, so first and last name.
Anna Muhammadi.
Okay, and then I'm going to also ask them their date of birth.
It is September 18, 1990.
Okay, and then after that, I'm going to make sure my patient is in the right position, which is going to be in the seated position. So she's in the right position for this first part, and we're going to perform the head-to-toe assessment on you. And I'm going to start with your vital signs. So I'm going to grab this chair. So we'll start with your radial pulse first. So with the radial pulse, we're going to palpate, and I would count for 1 minute. Okay, I got 70. This is within the normal range. You're not bradycardic, which would be less than 60, or tachycardic, which would be more than 100. Also, while I'm assessing the radial pulse, I will assess respiration rate of my patient. We're watching for rise and fall, which is 1 ventilatory cycle, and I would count for a whole minute as well. All right, and you got 15, which is within the normal range as well. And also, while she was breathing, I am noticing her effort, so she wasn't using her accessory muscles. I also didn't hear any audible wheezing or stridor. All right, and breathing was effortless and quiet. Now we would move on to take blood pressure. So for blood pressure, I would first find the brachial artery. Once I find the brachial artery, then I'll choose the appropriate cuff size for the patient's arm and place it 1 inch above the AC. Once we've done that, I would then find my brachial artery again, pump up the blood pressure cuff, and until I don't feel the pulse anymore, and then that'll let me know to go 20 to 30 above to assess blood pressure. So then I'll release the cuff, let the arm breathe for a second, and then we take blood pressure. When I take blood pressure, I'll use my stethoscope, and we place the diaphragm here, and I pump up the blood pressure, and then release. That first sound that we hear would be the systolic, and the very last one would be the diastolic blood pressure. So blood pressure was 120/80, which was that's within the normal range, so you're not hypotensive or hypertensive. Okay, so that concludes the vital signs. Now I'll move on to assess your lungs and chest. So first for this, I would let the patient know that I'm going to expose them a little bit so I can see their chest better. So we pull down the gown, and we're going to inspect. So we're going to look at the color, we're looking at the symmetry. So her AP diameter is 2 to 1, which is good, no barrel chest. Also, we're looking at the no venous patterns are noted, her ribs are not prominent, and we're also looking for any abnormal looking moles, which I don't see any. We look on the front as well as the back. And now I'm going to assess your anatomical landmarks. So first, we will locate the trachea. We're making sure it's midline, which it is. Then we find the suprasternal notch, then the angle of Louis, and then we come down to the costal angle. Okay, which is less than 90, which is normal. So then also while I'm here, I'm going to have the patient breathe in and out for me. Beautiful. Oh, you're okay. All right, so we had equal rise and fall of both hands symmetrically on both sides. I would also perform this on the back. But that's fine. And then we also locate C7, T1, which is right here in the back. We locate C7, and then T1 is right underneath that. And we'll come back to that when we assess the lungs, when we start listening. So those are my anatomical landmarks, and as stated earlier, I didn't hear any audible wheezing or stridor. Your rate was within the normal limits, and no use of accessory muscles while breathing. All right, now we'll go on to listen to your lungs. Okay, and we're gonna listen in a stepwise, side-to-side fashion. And we'll do anterior, posterior, and laterally. So we'll start with the anterior, and while I am listening, I'm going to be using the diaphragm of my stethoscope. I'm going to ask the patient to breathe in and out through their mouth, and also at each spot that I go to, she's going to breathe in and out through her mouth, and then throughout the whole assessment of the breathing, I would ask the patient if they feel dizzy or if they need to take a break. All right. So we'll do anterior. Okay. Good. Down. Okay. Okay, so that was anterior, and then for posterior, that's when we find this C7T1, and then we go 10 spots in the back in that stepwise, side-to-side fashion down the back. And then for since we're on the left side, we have 2 lobes. We would ask the patient to put their arm across, good. And then we would do a stepwise side to side in 3 places since we have 2 lobes on the left. On the right side, we'd ask the patient to do the same thing. So, and then we would do a stepwise side to side in 4 places. Thank you, ma'am. And that, while I was listening, I heard normal breath sounds, which is the bronchial over the trachea, bronchiovesicular over the main bronchi, and then vesicular over the peripheral lung fields. I didn't hear any adventitious breath sounds, which is crackle, wheezing, friction rub, or rhonchi. So the lungs were good. And I'm also going to check my card real quick, and we're going to assess for crepitus. So I'm just feeling for any air that is trapped underneath the skin, and no crepitus was noted. Okay?
Yes, ma'am.
All right. Okay, and now we will move on to the heart. Okay, so first with the heart, I'm going to assess your arteries. So we're going to start with the temporal arteries. Okay, so amplitude is 2+, and rhythm is regular, and they were equal on both sides. For the carotid, we'll use one finger, and the side that I am on will test this carotid. Good, and then we'll go to the other side to test the other carotid. Okay, good, so amplitude was 2+, rhythm was regular, and they were equal symmetrically both sides. Then we'll do the radial pulse. All right, so amplitude 2+, regular rhythm, and equal on both sides. Then we would do the dorsal pedis, which are going to be right here. All right, so amplitude 2+, regular rhythm, and then posterior tibialis is right underneath that middle ankle bone. Okay, amplitude 2+, regular rhythm, and then for the popliteal, ideally I would ask my patient to lay on their stomach and slightly bend the knee. And we would feel for the popliteal pulse, which is amplitude 2+, and regular rhythm, and equal bilaterally on both sides. All right, now I'll assess for bruits. Also with the pulses, as I stated earlier, her rate was 70, which wasn't bradycardic, which was less than 60, or tachycardic, which is greater than 100. Right, now we'll assess for bruits, and for bruits I'll use the bell of my stethoscope. So we'll do temporal, good, temporal, and then we'll do the carotid, and for the carotid I'm going to ask my patient to go ahead and hold their breath. Okay, now you can go ahead and breathe. Then we're going to go to the other carotid. Go ahead and hold your breath for me. Okay, now you can breathe. And then we do the abdominal aorta. And then we do the right renal artery and left renal artery, which are in the upper quadrants of the abdomen. And no bruits were noted. So now I'm going to move on to occlusion of blood flow. So we're looking at the skin color, so I don't see any pallor or mottling. I don't see any edema on the legs or the upper extremities. We'd also check temperature, so I'm using the back of my hand. We check for temperature. Temperature is warm, so the skin is warm throughout the arms and the legs and equal on both sides. We check the nails, so we check for capillary refill on all fingernails. Okay, so capillary refill is less than 2 seconds on the nails. Also with the fingernails, I don't see any clubbing or cyanosis of the nails. The nail colors are appropriate for ethnicity and round and smooth. And then we'd also check the capillary refill on her toes, and capillary refill is less than 2 seconds. And so after doing all of that, no occlusion was found. Now, I'd also ask the patient, do you have any tingling or numbness in your arms or legs? Okay, good. And then now I would go on to listen to the heart. Okay. All right, so we'll start. I'm going to start by using the diaphragm of my stethoscope, and we're going to go in this order. So we're going to start in the right second intercostal space. This is going to be the aortic. Then we're going to go to the left second intercostal space. This is going to be the pulmonic. Then we're going to go to the third intercostal space, which is Erb's point. And then we're going to go to the fourth intercostal space, which is the left side tricuspid valve. And then we're going to go to the midclavicular line, left side, fifth intercostal space for the mitral valve. Okay. And then I would also do this with the bell in that same order. I heard S1 and S2 heart sounds, no S3 or S4. Also, I'm going to palpate the PMI, which is the point of maximal impulse, which is right here in that midclavicular line, fifth intercostal space, left side. All right, so amplitude 2+ and regular rhythm. Also, as stated earlier, we would also visually inspect the chest like we did in the lungs. Also, I didn't see any lifts or heaves from the heart with just visual inspection. All right, and then if I was to hear a murmur, I would hear systolic stenosis with the bell of my stethoscope, or I would hear diastolic regurgitation with the diaphragm of my stethoscope. For me to hear this better, I would ask the patient to either lean forward or to the left. All right. Now we will move on to the abdomen. I'm going to ask my patient to lay down on our lovely table. As she was getting into this position, I am noticing the patient's behavior, noticing any grimacing on the face or any guarding of the abdomen, which she did not. Then I would visually inspect the abdomen I would tell the patient we're gonna lift it up. Thank you, ma'am. And then visually inspecting it, we're looking at the color, noting any stretch marks. We're noticing the color, the symmetry, making sure that the umbilicus is midline and that it's not laterally to either of the other sides. We're also looking for any masses or hernia, and then I would ask my patient, go ahead and lift your head. Good. So while she's doing that, you can go ahead and put it down. I didn't see any masses, hernia, or separation of the abdomen muscles. So then I will go on to listen in this order to, we're listening for bowel sounds and the frequency of the bowel sounds. So we're going to start in the right lower quadrant. Okay, and then we will go to the right upper quadrant, left upper quadrant, and left lower quadrant. Good. So normal bowel sounds were heard and the frequency was regular. We could potentially listen up to 4 minutes, but in this case we didn't have to do that. Now I will go on to palpate, and then I'll also identify the underlying organs that are in each quadrant. So in the right lower quadrant, we have the appendix. I don't feel any enlargement or distension of the appendix. We also don't have any resistance from the patient. No masses either. We'd also ask the patient if they have any pain or tenderness. Then we move up to the right upper where we have the liver. I don't feel any enlargement or distension or any masses of the liver. I would also ask pain or tenderness. Left upper, we have the spleen. I don't feel any enlargement or distension or any masses. No resistance from the patient as well. And then pain or tenderness. Then the left lower, we have the descending colon. I don't feel any enlargement or distension or any masses in that area. And we also ask the patient if they have any pain or tenderness. Okay, and then we can let the patient know. You can go ahead and put this down, and then I'm going to ask them a couple of questions. Do you take any medications?
No.
Do you have any issues with the urinary tract?
No.
Do you have any leaking of urine?
No.
Do you have any abdominal pain?
No.
Any nausea, vomiting?
No.
Okay, have you had any abdominal surgeries?
No.
Okay. Also, when was their last bowel movement?
This morning.
Okay. And then we asked them the frequency, so how frequently do you have a bowel movement? The color, the consistency, has anything changed with your bowel movements? Okay, that's all of my questions. Then we will move on to musculoskeletal. So I'll ask my patient to sit up for me. No, I'm actually gonna have you stand first. So for musculoskeletal, first we would, ideally we would have the patient degarm. So they would degarm for us, and then we're just looking at their skeleton. We're assessing their extremities, making sure everything is even. We're looking at the shape. We're gonna look in the front. We would look laterally on each side, as well as the back. So we look posteriorly as well. We're looking at the normal curvature of the spine. We also look at the skin and subcutaneous tissue over the muscles and joints for any discoloration or swelling and masses. And then we also would inspect the muscles for size, symmetry, spasms, fasciculations, and of course we're going to compare everything side to each other. So we're going to compare this arm to that arm. And then for each major muscle joint, we're going to test active range of motion and passive range of motion and comparing the sides to each other. And then also for each major muscle joint, we are palpating for muscle tone, heat, tenderness, swelling, and crevitus. All right. So first, I'm going to start with your TMJ. So for the TMJ, I am going to palpate right here on my patient, and then I would ask them to open and close their mouth and move their jaw side to side and forward and backward. Good. Also, clench your teeth for me Thank you. Keep them clenched. Go back and clench again. Good. So strength was good on the master and temporal muscles. And also when I'm palpating, I am listening for any popping or clicking at the jaw, and none was noted. Then I'll test the strength of the sternocleidomastoid and the trapezius. So I'm going to place my hand here on the patient and ask them to turn towards my hand, so I'm providing a little bit of resistance. Good. Then we're going to do the other side, provide a little resistance, making sure that they can turn their head. And then I'm going to place the palm of my head on their forehead and ask them to look down while providing resistance. Good. And then we're going to do the same thing for the back. Good. Providing resistance there. So this last one was for the trapezius muscle. The first two were for the sternocleidomastoid. Okay, and then we'll move on to your cervical spine. So for the cervical spine, first we would palpate the cervical vertebrae right here, noting any pain and making sure everything is symmetrical and midline. And it is, so then we'll do range of motion. So we're gonna put our chin towards our chest, so you're gonna go as far as you can. Good. And then we're gonna do the same thing for extension, but we're gonna go the other way. Good. And then we're gonna put our ear towards our shoulders. Good. And then the other way. And then I'm also gonna ask you to rotate with keeping everything forward except your head. So we're gonna rotate to the left and rotate to the right. Good. And that will be cervical. Now I'm going to move to your shoulders. So for the shoulders, first we palpate each shoulder joint. We're feeling for any deformities, asking the patient if any pain. We'd also palpate the scapula. Thank you. Okay, and then we're going to do range of motion with the shoulder. So we're going to go, we can do both at the same time. So we're going to go forward. Good. And then we're going to go backwards. Good. And then we're going to raise both our hands up towards the sky. Go as far as you can. Good. And then we're going to bring them down. Good. And then we're going to do internal and external rotation. So for external rotation, we're going to rotate this hand back and go towards the back of your head as far as you can. And then for internal, we're going to place it on our back. Perfect. And then we'll do the same thing with our other one. So internal or external and then internal. Good. And this will be internal with adduction, and then this is external with abduction. Okay, so good with the shoulders. Then we will move on. I'm going to do your thoracic and lumbar spine. So with the thoracic and lumbar spine, I'm going to have you face this way for me, just real quick. We palpate all the vertebrae going down, making sure everything is in the middle, noting any deformities, also asking the patient for any pain. Okay, and then we would now assess range of motion. So I'll stand in front of you. So now we're going to do flexion. So we're going to bend forward as far as we can. Good. And then we're going to bend backwards. So basically do the same thing, but going the other way. Good. And then we're going to laterally bend. So we're going to bend this way, and then we'll bend the other way. Good. And then we'll also do rotation. So we're going to keep our hips forward, and then we'll just rotate our upper half of our body. Good. Perfect. So range of motion was good there. Now we will go on to elbows. So with the elbows, first we palpate the medial epicondyle, lateral epicondyle, and olecranon process. We also palpate along the ulnar surface here, feeling for any abnormalities, swelling, any of that stuff that I stated previously. We do it in flexion as well as extension, and we would do that on both sides. Good. Then we would do range of motion. So range of motion for the elbows, we're going to bring those palms up towards our shoulders as far as you can. Good. And then extension, we're just going to bring it back down. Perfect. And then we have supination and pronation, and then back to supination. Good. Range of motion was good there. And now we will move on we're gonna go back to the shoulders real quick. For strength, I'm going to, well, also range of motion, so I'm gonna have you shrug your shoulders. So we do range of motion there, and then keep your shoulders shrugged for me. Don't let me move you. Good. And then I'm gonna have you put your arms up. Okay. And don't let me move you. Perfect. Strength is a 5 out of 5. Okay. We did elbows, back. Okay. Now we will go on to hands and wrists. So with the hands and wrists, so first we are going to inspect. We're going to palpate each finger. We also palpate the bones in the hand as well as the bones in the wrist. We look at the color, the size, the symmetry of them, and the shape of them as well. We also look, we also note the number of digits. So she has 5 fingers on each hand. So we would note that. We also look on this side as well and palpate. All right, so that's fingers and wrists. Now we're gonna do range of motion. So this one can be a little tricky, so I'm just gonna have you follow my movements, okay? So we'll start like this. We're gonna do wrist flexion, good. Wrist extension, good. Finger flexion, finger extension. Then we're gonna do abduction, so we're gonna spread the fingers apart, and adduction, bring them together. Good, then we're gonna turn our hands this way. We're gonna move our thumbs towards our pinky, good. And then we're gonna make a fist, perfect. Right, and then that's wrist and hands. Now we'll move on to your hips. So for hips, first I'm going to look at the hip symmetry. So we're making sure the hips are symmetric, that one is not higher than the other, and her hips are even on both sides. All right, now I'm gonna have you lay down for me. Okay, so first I'm gonna have you bend this knee and you're gonna bring it up towards your chest. Good. And then right here, don't move it. Don't let me move you. Perfect. Okay, then we do the same thing for the other leg. Perfect. And then don't let me move you. Perfect. Strength was a 5 out of 5 on both legs. Then I'm gonna have you keep that knee straight and do the exact same thing. So bring that leg up. Good. Keep it there. Don't let me move you. Perfect. Strength 5 out of 5. The other leg, don't let me move you. Strength 5 out of 5. Good. And then we are going to assess internal and external rotation. So I'm going to have you bring this, you're going to bend this knee, put this foot on the ground. Good. Or on the table, sorry. And then I'm going to have you bring this knee as far over as you can. Good. Perfect. And then I'm going to have you place this foot over this knee and bring this knee down to the table. Good. And then we're going to do the same thing for that other leg. Okay, so bring it up, bring this knee this way, perfect. Bring this foot over here and then bring that knee down to the table. Perfect, and then I'm going to ask you to keep this knee straight and you're going to bring your leg towards me. Good, and then you're going to bring it across as far as you can. Good, we'll do the same thing with the other leg. And then that way. Okay, and then I'm just gonna have you raise this leg up for me. All right, you can bring it down just a little bit. Perfect. And then just don't let me move you. Perfect. And then we're gonna go the other way. Sorry, bring it up for me. The other way. Good. And then we do the same thing with the other leg. Don't let me move you. Good. Don't let me move you. Perfect. Okay, and then I'm gonna have you get on your stomach. And then you're gonna keep this knee straight, you're gonna keep those hips on the table and just raise it up. Perfect. And you'll do the other leg. Perfect. Good. All right, so range of motion and strength for the hips was good. Now we will move on to the knee. So I would ask my patient to get up. Yeah, you can come to the side of the table. First, I'm going to palpate and inspect the knee. We're palpating and inspecting all along the patella, the joints in the knee, as well as the popliteal space, noting any pain, tenderness from the patient, as well as any deformities. Then I'm going to ask my patient to stand up. And we're going to do flexion and extension. So if you need to hold onto the table, you can. If not, you're okay. So we're going to bring that heel towards our butt as far as we can. Good. And then we're also going to extend it. So bring it up like that. Good. And then we'll do the same thing with the other one. foot towards her butt, and then go to the sky. Yeah, good. And then I'm gonna ask the patient to sit down, and then we're gonna assess the strength of the knee, inflection and extension. So just don't let me move you, okay? Good, and then the other way, good. And then we'll do the other leg, don't let me move you, good. So strength is a 5 out of 5 for legs, for the knees. Then we will do the feet and ankles. So for this one, we would palpate the Achilles tendon on both sides. We also palpate all the bones in the feet. We count the number of digits. We're looking at the size and symmetry of the toes and the feet. Then we're going to do range of motion and strength. So if you want to go ahead and stand up for me. So we're going to do weight bearing and non-weight bearing. So we're going to do non-weight bearing first. So I'm going to have you point your toe towards the floor, yeah, and then bring that toe up towards the sky. Good. And then we'll do the same thing with the other foot. Toe towards the sky, toe towards the ground. Good. And then for weight bearing, I'm gonna have you get on your toes and then come back down. Good. Then we're gonna do inversion on both feet. So this will be inversion, and then we're gonna do eversion. Good. We'll do the other foot as well. Inversion and eversion. Good. Then I'm going to ask my patient to sit down for me so we can assess the strength of those. So I'm gonna have you point your toe down towards the floor. Good. Now don't let me move you. Good. We'll do the same thing on the other side. Point it down. Don't let me move you. Good. And then bring that toe up towards the sky. Don't let me move you. And don't let me move you. Perfect. I'd also ask the patient to flex their toes, so they're going to scratch with their toes and also extend those toes. Perfect. All right, and that concludes musculoskeletal. Now we will move on to cranial. Okay, so first I'm going to grab something sharp and dull. Okay. So I would ask my patient to close their eyes. I'm gonna let them know first, this is sharp and this is dull, okay? All right, and so tell me if that is sharp or dull.
Sharp.
Sharp, okay, and where are you feeling it?
Upper right arm.
Okay, perfect. And then,
Dull.
okay, where are you feeling that?
Upper left arm.
Okay,
Dull.
okay,
Upper right arm.
perfect. And then,
Sharp.
okay,
Upper left leg.
perfect.
Dull. Upper right leg.
Okay,
Dull. Upper left leg.
okay, good. And then I'm going to have you're gonna keep closing your eyes. And then I'm gonna put something in your hand and you're gonna tell me what it is, okay?
Razor.
Yes, perfect. And then I'm going to place your finger in a certain position. You're gonna tell me what position it is in and what finger it is, okay? All right.
Ring finger down.
Okay, perfect. And what hand was that?
Right.
Okay. And
Index finger down,
perfect.
which is left hand.
Yes, perfect. Okay, and then now I'm going to draw a number in your hand and you're going to let me know what it is while your eyes are still closed. Ready?
3.
Good. And then I'm going to draw a number in this hand and you let me know what it is.
0.
Perfect. All right, and then now I'm just gonna pick a random spot on you and you're gonna tell me where I'm touching you, okay?
Lower left leg.
Perfect. All right, and then you can go ahead and open your eyes for me. And then I'm gonna have you're gonna have your hands like this, then we're gonna do this, and we're gonna do it fast. Good, so this is rapid rhythmic movement. We're testing the accuracy of the upper and lower extremities. And now we'll do the Romberg test, so I'm gonna have you stand up. You're gonna put your feet together like this. You'll have your hands by your side. And then I would come over here to give the patient some assistance. I'm gonna ask the patient to close their eyes. And then I would wait here for 30 seconds. All right, perfect. Good there, balance is good. Then I'm going to ask the patient to take a couple steps for me so I can watch their gait. So if you wanna go over there, take a couple steps that way, perfect, and then come back to me. Perfect. So gait was symmetrical, and she had opposite hand going with the opposite leg. So gait was good. Now we're going to assess your reflexes. Okay, so I'm going to have you sit down. Right, so for the patellar, we're going to test the patellar reflex here. Good. And then we'll test it on both sides. Good. And then we'll test the Achilles. Okay, we'll test the other one. Perfect. Oh, got stuck on me. Okay, and then for the plantar reflex or the Babinski's reflex, I would have you scoot back for me. And then I would take the sharp side of the reflex hammer and we'd start at the heel of the foot and we make a C-shaped on both sides. And for this, we're making sure that the toes curl and we do that on both sides. Good. Okay, now we'll go on to assess for cranial nerves. Yay. So we're gonna do cranial nerve 1, which is olfactory. So I'm gonna ask the patient to close their eyes and then occlude one of your nostrils. So close one of your nostrils up, okay? And then I would get a scent like vanilla or lavender, place it under their nose and ask them what the scent is.
Lavender.
Perfect. Okay, and then we're gonna do the same thing with the other nostril. So go ahead and close your other nostril. All right, we're placing something under the patient's nose, asking them.
Vanilla.
Perfect. Okay, and that's olfactory. Then optic. For optic, we use the Snellen chart. So if the patient has glasses or contacts, we'd ask them to keep them on. And then the Snellen chart would be 20 feet away. Ask him to cover one eye with an opaque card, and then ask them to read the smallest line they possibly can. And then I would also ask them to do it with the other eye, so they close their other eye, read the smallest line you can. And then I also ask them the colors, so what colors are they seeing of the horizontal lines, and then which one's shorter or longer. Okay, and then we have the confrontation test. So I'm going to have you cover one of your eyes. So pick an eye. So if she's covering her right, I would cover my left. And then you're going to let me know when you see the pencil. Okay? Ready?
No.
Okay.
No.
Okay.
No.
Okay.
No. No.
Okay. And then we're going to do the other one.
No.
Okay.
No.
Okay.
No. No. No.
Okay. Good. So peripheral vision is good. So now we have 3, 4, and 6. So 3 is ocular motor, 4 is trochlear, and 6 is obducens. For this one, we do 6 fields of gaze. So I'm just gonna have you follow this pencil. Don't move your head, just move your eyes, okay? Good. Good, good. And then follow it. Perfect. Okay. And then I'm going to assess the pupils. So for this one, I'm going to have you stare at something farther away, and then I'm going to shine the light into the eye that is closest to me, making sure it constricts, and it does. Sorry. And then I'm also going to do the same thing, so I'm going to shine it in the same eye and make sure that the other pupil constricts as well. So keep staring at that distant object, good. And the other eye constricted as well. We do the same thing on the other side. Keep staring at that distant. Perfect. Second, and then we stare at the other one. Good. Good there. And then I'd have them just stare at the distant object. From here, we're just looking to see if the pupils are constricting, and they are. And then I would ask the patient to stare at this pencil, which is something close, not pencil, pen light. And we're watching the eyes dilate, which they are. Good. So the pupils are equal, round, reactive to light, and accommodate. Okay? Then we would move on to cranial nerve 5, which is trigeminal. So we would assess the branches of the sensory. So we ask the patient to close their eyes. And then we're doing this is the ophthalmic branch, making sure that the patient can feel that. Can you feel that? Okay. And then we do the maxillary branch. Yes. Perfect. And then the mandibular branch. Good. We'd also do it on the other side as well. Perfect. And then for that one, I'm gonna palpate here and have you clench your teeth. Perfect. And the strength is good there. Then we'll move on to facial. So for facial, I'm going to have you raise your eyebrows. Close your eyes tight. Open them. I'm gonna have you smile. Show your teeth. Puff up your cheek. And purse the lips. Perfect. And then say BMW for me.
BMW.
Perfect. Making sure that's all of them. Okay, good. Then we'll move on to cranial nerve 8, which is going to be acoustic or vestibular cochlear. We have 2 tests for that one. So one of them, we take a tuning fork, hit it on the palm of our hand, and place it on the middle of their head and ask the patient, do you hear it equal on both sides or do you hear it more on one side or the other? Okay, and then we have the whisper test. So for the whisper test, I'm going to stand on one side. I'm going to ask the patient to close the opposite ear up, and then I'm going to whisper a 1-syllable word and then a 2-syllable word. Excuse me.
Ball.
Okay.
Heart shape.
Yep. And then we do the same thing on the other side.
Cat.
Okay.
Baseball.
Perfect. Okay. And so cranial nerve 8 is intact, and then now we move on to 9 and 10, which are glossopharyngeal and vagus. So we have the gag reflex, so we would put a tongue depressor on their tongue and see if that can elicit that gag reflex. And then also we have the patient say ah. Perfect. And we're watching the soft palate and uvula move up and equally symmetrical on both sides. Okay, and then that brings us to cranial nerve 11, which is spinal accessory. I'm gonna have you shrug your shoulders. Don't let me move you. Perfect. And then we also would do this one as well. So I place my hand, have the patient turn. Good, providing that resistance. Do the same thing here. Then we have the palm and the one in the back. Perfect. Okay, then we have cranial nerve 12, which is hypoglossal. So this is the tongue. So we have the patient stick out their tongue, move it towards their nose, move it towards their chin, and move it side to side. Perfect. And we are all done with your head to toe. Yay!